Dr. Leanne Poston, Career Advisor for Wright State University Moonshop School of Medicine, and I'm here today to talk to you about third-year away rotations. A third-year medical student starts planning their schedule for the fourth year during their third year. They have this prime time from the end of third year until September 15th when their application is due to try to make their residency application as competitive as possible. From September 15th until January, they're mostly interviewing, so it's a risk to go and do an away rotation because then you may not be available for your interview. And from January until the end of medical school, generally they're doing away rotations, global health initiatives, or other things to meet the requirements of their medical school. So from June until September is 3 blocks. Frequently medical students will do one block, CK or CS or both, in order to make sure that those test scores are available for residency program directors when their applications are uploaded on September 15th. For the other 2 blocks, they have to evaluate how they can make the best use possible of those 2 months to make their application as competitive as possible. So there are 3 reasons that medical students usually choose to do an away rotation. 1, because they want to go someplace. They either want to go to Alaska, and work on an Indian reservation, or they want to go to Florida or California in order to be at the beach, or they have family they haven't seen in a while and they want to spend some time with them. The second is they need something, and that's usually in 2 categories. They either need a letter because their medical school does not have a particular specialty. For example, our school doesn't have a neurosurgery department. So a student's going to go to a medical school that does have a neurosurgery department, 1, to get more experience in neurosurgery, and 2, to get a letter from someone who is an expert in the field because that's going to be held with more regard. The second reason to go is Wright State is in the Midwest. So it's well known in the Midwest, but it's not so well known on the East Coast, West Coast, Denver, and Chicago, which are all very competitive areas of the country for residency. So it's a good idea for a medical student to go to those areas of the country and do an away rotation there in order to get a letter from someone who is well known in that area. If you get a letter from somebody and you apply to a program in that area and they know the person who wrote the letter, that's of course going to be held in higher regard than a letter that is from someone that they're not familiar with. And then the last reason to do an away rotation may be because your step score isn't just what it needs to be in order to be competitive in that specialty or for that program. After all, they are hiring a clinician. They're not hiring someone who's good at taking tests. So it makes sense. So you go and you do a 30-day away rotation and show them how great your clinical skills are. If you show them that, then possibly if your step score is mediocre, they'll ignore that or not weigh it quite as heavily in favor of your great clinical skills. That plan can backfire, however. There is the possibility that you get the flu or you get sick, or you have a personality conflict with somebody that you're working with there, in which case it's going to be hard to impress them for that 30 days. And if you just don't have the people skills or the ability to be on top of your game for 30 days, you may be better off considering not doing it. So as you can see, there's lots of reasons to think about doing an away rotation. You're best to meet with your advisor or mentor and discuss all of the various options. Well, hope this was helpful.